comparison, the kinds of comparison you made when you are doing an analysis, and the reporting, and then the inference is drawn. This is little more complicated than effect modification. Effect modification, remember I told you, has programmatic or policy level, even implications for clinical practice. Interaction also has such implications. Now, if you consider that all of these processes which we encounter in our research are inherently complex processes, then the interaction between exposures is just one of the manifestations of this complexity. So we talk of interaction between genetic factors and environmental exposures, or environmental exposures themselves, or genetic exposures, behavioral exposures. So there can be various kinds of interactions. Now, what happens in interaction? What are we interested in is that we are interested in the joint effects of multiple exposures, usually say 2 exposures. So we are interested to see whether these joint effects, how are they differing compared to independent effect, the combined independent effect measures. So you have 2 measures. If you combine the effects of these 2 measures, how is your joint effect with regards to the combined effects of these effect measures independently? That is interaction. If this is more or less, you say there is an interaction. So you are interested in the joint effects. What were you interested in? Effect modification this was a third variable, your effect modifier, and you were wanting to see whether the effect of exposure and outcome differed in these with respect to the third variable. Now this is a little bit different. You want to see the effect of exposure A, you want to see effect of exposure B on the outcome, and then you want to see the effect of A and B on the outcome and see whether this is different when they are together present compared to the independent sum of the independent effects of these exposures. That is interaction. So you'll get some more clarification as we move ahead with examples. Now, with interaction, what is important is the scales. There are different scales of measuring interaction. One is a multiplicative scale, and the other is the additive scale. Multiplicative scale means what? The combined or the joint effects of the exposure is equal to or more than the product of each independent effect. That is a multiplicative scale of measurement of the interaction. And when the joint effect is equal to or more than the sum of each independent effect, you call it as an additive scale of measurement. Now, if the joint effect is more, you say there is a synergistic interaction. If the joint effect is less than the sum of the individual effect, you say it is an antagonistic interaction. All of this happens in your analysis. Now, how do you depict interaction? Now the lower portion is the one for your effect modification. So you have, say, smoking, and you have asbestos exposure, and you have, say, lung cancer as your outcome. So what do you do in effect modification? Supposing you have asbestos exposure as an effect modifier, you would have 2 strata, asbestos exposure yes and no, and then you will have your measurement of the effect in each of these 2 strata. But when you talk of interaction, what happens? You have the same thing actually, that is no exposures, only smoking, only asbestos, smoking and asbestos. And you have no smoking, no asbestos as your reference. And you are going to calculate a relative risk for smokers with respect to your reference group, for non-smokers with respect to your reference group, and for those with both the exposures with respect to your reference group. This is how the two differ from each other. Are you getting this?
Yes, ma'am.
Yes, ma'am.
This is getting a little bit complicated. What happens in effect modification is that you make strata according to your effect modifier. So if asbestos exposure is your effect modifier, you say I have 2 categories with and without asbestos exposure, and I calculate the effect of smoking on lung cancer separately for these two subgroups. When I say I'm interested in interaction and not effect modification in my reporting, I am going to report the upper table where I am going to calculate the relative risk of each of the exposures to the reference group in which both the exposures are absent. This, is interaction. So measures of interaction, actually, when you are looking at measures, the measures can be in terms of risk difference, it can be risk ratios or odds ratios, and you can measure the interaction, as I told you, on two scales, the additive scale and the multiplicative scale. Now, in the additive scale, what are the ways in which you can do your analysis? One is look at the underlying additive interaction for risk. There is a term known as RARI, AP, and synergy index. All of these I am going to explain in the forthcoming slides. Now, these are the different strata which we have already seen. That is the exposure, the two exposures present, absent, and this is the risk in each of these four groups. Now, for additive interaction, what you do is you find out this is a minus here. So you take the risk in this particular group where there is an interaction present, and you subtract all the other risks from this risk in the group where both the exposures are present. Are you getting here? Are you with me? Because I understand that this can be a little bit complicated. Are you with me?
Yes, ma'am. Yes, ma'am.
So
Ma'am,
this
could
is,
you please repeat?
yes. See, in the interaction, what we are interested in is these four groups. So you have exposure, two groups of exposure, yes, no, exposure 1, exposure 2, yes, no. So this is a category of people in whom there is no exposure. Either of the exposures absent, one exposure present, the other absent, the first exposure absent, the second present, and both exposures present. These are the four categories. Got it, Shahrukh?
Yes, ma'am.
And these are the risks which are there for each of these four categories. So to assess
Yes.
additive interaction, you consider the risk in the fourth category and subtract the sum of these risks from this fourth category. If this difference is positive, then you say it is a positive or a super additive interaction. And if this difference is less than 0, then you say it is a negative or a sub-additive interaction. Okay.
Yes, ma'am.
So if it is a super additive interaction, then it has a public health consequence because it means that the intervention on E would be larger in the group or in individuals who are in G is equal to 1 group. And if your difference is suggesting it is sub-additive interaction, it means you better give the intervention to individuals in the G0 group. I'll come back to this, which is simpler with the further calculations. So actually this additive interaction helps us to identify, it has public health significance because it helps us to identify in which group your limited resources should be concentrated on. So additive interaction does have public health relevance. If I have an example, yes. Now this is an example of effect. This is the effect of smoking on lung cancer and how it is affected by exposure to asbestos. So these are the four risks I was talking about. Now this is the first risk in individuals who do not have either of the exposures. This is only asbestos, this is only smoking, and this is the risk for individuals who have been exposed to both asbestos and are smoking. So when you want to find the difference and assess for additive interaction, you find the difference of this value here with the sum of all these other risks, and your difference is more than 0. So it is a supra-additive interaction, right? You are with me?
Yes, ma'am.
And when it is a supra-additive interaction, it means you have to focus on individuals who have this particular uh, exposure. It means removing asbestos from the homes of the smokers. Now here, if you feel that this is a easier task, removing asbestos, than asking people to give up smoking, then this kind of analysis tells you that you will have a better impact if you focus on removing asbestos from homes of smokers first and then go to the other groups. This is how
Excuse me, ma'am.
Yes, please.
Ma'am, here we are subtracting all the other groups from 0.045, right?
Yes.
So, okay. Okay, ma'am.
Yes. Yeah. Then another concept is this RARI, or relative excess risk due to interaction, also known as interaction contrast ratio. So you just have access to relative risk values, still you can calculate your additive interaction. The same thing, the relative risk for those who have both the exposures, you subtract from the remaining 3. And if it is positive, negative, you talk about the supra-additive, sub-additive, or no additive interaction. If your RARI is more than 0, it means the public health consequences of the intervention on E, on one of the exposures, would be large for the group which has the other exposure also. And if RARI is less than 0, it means your intervention should be focused. Intervention on one exposure should be focused on the group which does not have the second exposure. So this interaction too has public health consequences. RARI, unlike the previous formula, when you're using the relative risk or RARI, what I want to tell you all is that you do not give any value to the magnitude here, but only to the direction, that it is positive or negative. Because in RARI, you do not look at the baseline risk. So don't look at the magnitude of RARI, only if it's positive, negative, and then decide, okay, you are able to intervene on one exposure. So which is the group you should focus on? The presence, the group which has the other exposure or does not have the other exposure. This decision is what this kind of additive interaction helps us with. Are you with me?
Ma'am, I have a doubt, ma'am.
Yes.
Ma'am, this previous example, the odds ratio here are adjusted odds ratios, ma'am, or crude odds ratios, ma'am?
Adjusted. They can be adjusted odds ratios. Yeah, whatever the output is there with you, because many of these softwares, even now, they do not directly give you values of RARI. You have to do it manually. So whatever values you get, you use those to calculate and come up with your comment on additive interaction.
So because like I just had the doubt, if we subtract the odds ratio without adjusting, then it would be wrong, right, ma'am? We cannot subtract and then infer about without adjusting.
Yeah, so you have adjusted values, you have to use adjusted values. Yes.
Okay. Yes.
Yes.
Okay.
So this is an example of, again, the example of smoking and asbestos exposure. Here, RARI, so you have first all these values, you calculate your relative risks for the 3 exposures and with the baseline, with the reference group. And then for RARI, what do? This is 60 is the relative risk for those who are smokers and have asbestos exposure. You subtract the rest of the relative risks and you get a positive value which is more than 0. So you say that this is a synergistic or a positive interaction on the additive scale. Another calculation which is done is attributable proportion due to interaction. Now what is this attributable proportion to interaction? This is nothing but out of the total interaction which is there, the proportion of the risk which is attributable to the interaction per se. So the proportion of the risk in the doubly exposed group which is due to the interaction per se. So R11 is the risk in those who have exposure to both the groups. Of this total risk which is there, how much is due to the interaction per se? That is attributable proportion due to interaction. So if this I'll not talk about this sentence, but just look at this same example. 46 was your RARY, 60 was your relative risk for double exposure. So 77% of the risk in those who have the double exposure is because of the interaction itself. So this is another calculation you can do when you are checking for interaction. The third, or rather the fourth one, is synergy index. Synergy index is again used to assess additive interaction. You again use your measures of effect directly here, and you find out the extent to which your measures of effect for both the exposures together exceed 1. So this, both the exposures together exceed 1, and you are dividing this by the difference of each of these effects from 1. So this is the synergy index. Again, it's very similar to your RARY. If it is instead of 0, because now it's an index and you are looking at a divisor here, it is 1. So if it is more than 1, you say that there is a supra-additive effect. So different ways in which you can report your additive interaction, and there are studies which have reported these indices and measures. So for your example, the synergy index is 1.64. It is positive, means there is a supra-additive effect. So you just find the difference of each from 1, subtract 1 from each of the relative risks, divide, and you get your synergy index. So this was on additive scale. Now interaction on the multiplicative scale is nothing but you are dividing the relative risk where for both exposures divided by the product of relative risk for one exposure. If it is more than 1, there is multiplicative interaction which is positive. Less than 1, there is multiplicative interaction which is negative. And if it is equal to or near 1, we say that there is no interaction. In our example, it was 1.2. So very near to no interaction. Again, this example which I gave you all tells us that in the same example, there can be additive interaction with no multiplicative interaction. There can be interaction along both scales or vice versa, or no interaction at all. Anything can happen. Interaction is scale dependent. This is the message which I want to give. So these are the things for our interaction of the example which we considered. Now this is another example. I will not go through this. If you have understood, you can just note down this example and try and solve it. Can I move ahead instead of solving this example? Or do you want me to solve this example? It is solved here actually. So we have calculated the RARY, we have calculated the proportion, we have calculated the synergy index, and we have calculated the multiplicative interaction. And for studies, if you decide to assess for interaction, it is better to report all of this in your study. So do you want me to explain this, or do you think you can have a look at this and try and understand what's happening here later on? Because this clearly in this example, what do you see? That there is a additive interaction. 48% of the risk which is there with the joint exposure is because of the interaction per se. Synergy index telling us there is a synergistic effect. Multiplicative interaction telling us there is a multiplicative interaction also. And this is as per the formula which we discussed. So it's clear here.
Yes, ma'am.
Yes, ma'am.
Yes.
Others? Others, if I get a couple of more responses, I will go ahead.
Yes,
Ready?
ma'am.
Yes,
Okay.
ma'am.
So again, this is another example. You can just jot this down and try and solve it yourselves. These were the few examples. So interaction is scale dependent. This message I've already given. This just saying that there is an interaction. Because when we go ahead, I'll show you there are some tests which just tell you that there is an interaction. You should not stop there. You should check for additive multiplicative interaction and say which interactions are there and what is their public health significance. Now here, I told you that when you're looking at effect modification, you don't have to adjust for any more confounders. But if you are interested in interaction, you have to adjust for confounders for both associations. So you have exposure A and outcome, you have exposure B and outcome, and you have exposure A and B and outcome. So you have to have a list of confounders for this association as well as this association and adjust for all of these confounding when you are checking for interaction. And like effect modification, sample size, yes, larger sample size will be required if you're interested in interaction. So why would you be interested in studying interaction? Because limited resources means you want to identify subgroups which are at higher risk or where the effect of the intervention is largest. Even when resources are not limited, still you would be interested in interactions, effect modifications. If there are crossover or qualitative interactions, meaning beneficial effect in one, harmful in the other, then you would want to identify this group. Third reason why you would be interested in these concepts is because they help us to think about possible mechanisms through which the effect is happening. And I could not find a reason for this interesting possibility that there could be a synergism or an interaction in which there are two exposures at play and you cannot really do anything for one exposure. So, sorry, but you can intervene for the other, and the outcome does not occur until and unless both of them interplay. So in these situations, again, your identification of interactions become important. And the third is, of course, the last reason, of course, is that there is no reason, but only that the statistical model with interaction fits better than any other, which rarely you will take up this particular reason. But this sentence is important that whatever it be, you should be very clear about what your goal is when you are including effect modification in your analysis, which of these you are trying to do when you are doing your analysis for effect modification or interaction. Now, this is another example of an interaction of a mutation and OCP use in causing venous thrombosis. So, what you can see is that there are two strata, one where the mutation is negative, another where the mutation is positive, and you have the exposure OC use. So this is what kind, is it effect measure modification, this left side of the table, or is it interaction? The left side of the table, what is it showing? Will you?
Left side of the table is showing effect modification.
Yes.
Stratification. Yes, ma'am.
Yes, it is showing stratification and effect measure modification, right? So the
Yes, ma'am.
exposure here is OCUs and the effect modifier is the mutation, presence or absence of mutation.
Yes, ma'am.
And what do we see here? So we have the number of patients, the person years, and then you have incidence per 10,000 person years. And you can calculate the relative risk for both the groups. And they appear to be nearly similar. This is nearly equal to 4 and they are near each other, right? So possibly you could say if you have a 95% confidence interval and if they overlap or if your P value for interaction is there, it may be that there is no difference here in the relative risk of these two groups and there is no effect modification by the mutation. Now, when you look at the right side, this is showing you the same thing as an interaction because you are getting the relative risk for each exposure compared to this group, which is the reference group. So what do you see here? You can do all of your RARI, then your synergy index, or even your with the raw numbers, you can
then
see that there is an additive
multiplicative.
effect.
Yes, ma'am. Multiplicative is.
Yes, multiplicative interaction. You
And
can do
this
all
one
of
is there.
this,
Yes.
and if you just even if you do that raw thing, no, where you had the formula of P11 minus P01 minus P10 minus the P00, you will come up with this sentence which was there in this particular study. So 28.5 minus the three top numbers gives you 26 per 10,000 women years. So that number, which is a supra-additive effect, it tells us that in the presence of both these factors, that is the mutation as well as OCUs, the venous thrombosis, these many women will develop venous thrombosis. Extra women are going to develop venous thrombosis. And if you would prevent both of these from occurring together, you will prevent these many women per 1,000 women years from getting venous thrombosis. Now, in this particular study, even if they have come up with these numbers, there is interesting discussion that, remember, just effect modification, presence or absence does not lead to any policy decision, because they have thought about what is the prevalence of this mutation in the community in these women, and if it is less, then is there a point in investing so much in identifying women who have the mutation? So just mere presence of effect modification will not mean that any policy decision or action will be taken. There are other factors which come into play. Now this actually, this effect modification it utilizes multiplicative interaction. So your multiplicative interaction here, if you do 35.6 divided by 7.1 into 3.8, it is nearly going to be equal, somewhere near 1. So your interpretation is going to be there is no multiplicative interaction. And that is the reason I told you that in your studies, you should report both multiplicative and additive, because this number of 26 per 10,000 women, or even your RARI synergy, will tell you that there is a additive, super additive interaction in this association. And then your recommendations will change. So report both the interaction and, as discussed earlier, biological interpretation. Why is it that the effect is happening? Why is it that there could be an interaction? You have to be able to write this up in your discussion section. Again, a short break. If there are questions, you can ask me, because I will now show you in SPSS how to go about doing the interaction. Before the interaction, of course, your effect measure modification with adjustment for confounding. Any questions? Or do we stop here? That is another option. Of course, we do this later on.